I think we're leveraging the existence of Northeastern's co-op program to create college graduates who are 10 years older than they really are in terms of their ability to work in the workforce, do real work in real systems with team dynamics, and actually apply what they know to real problems. Our mission is to scale impact, solve problems, and do that simultaneously working with students, undergraduates, masters, PhD students, and postdocs, so that we can create a workforce that's 10 or 100-fold larger than it is today. Fundamentally, what our mission is and what we're trying to do is to integrate research, education, and application for impact to the point where they're sort of inseparable, and apply all of that to problems that healthcare has.
What healthcare engineers do is try to improve the quality of care while also reducing cost.
HSyE is a really fun environment just because we have so many students and we do a lot of fun activities, and also it's on campus, so for Northeastern students it's very convenient.
I've learned how to handle a team, handle a project on my own without any guidance, and that's something that I never would have learned without having experience in a real-world setting.
I heard Dr. Bennion speak at my previous school, and he talked a lot about healthcare engineering, and I got really interested in the program, so I looked up online and then applied, and I've essentially been here for a year as a co-op student.
So what originally attracted me to this program was just the healthcare industry in general. I didn't really know that I wanted to be involved in healthcare, and then once I met Professor Bennion and all the staff and the team members, I knew that I wanted to work there.
Healthcare systems engineers from HSyE are working in a wide variety of cities, systems, and roles within those systems to help with healthcare. The program was established very much to just go to healthcare systems and say, what are your problems, and let's see how we can help you.
Unlike the other healthcare co-ops, it wasn't just focused on one hospital, it was focused on a bunch of different healthcare systems.
At this co-op you get to experience a broad range of industrial engineering applications.
I got to work with nurses, doctors, pharmacists, case managers, executives.
If I ever do want to continue on in the healthcare field, I will have those connections in the industry.
I worked at Mass General, Leahy, Cambridge, and Wheaton hospitals. And I also worked at Commonwealth Care Alliance, which is a care maintenance organization that's not-for-profit.
I've also been working with South Coast Hospital, Lynn Community Health Center, and Boston Children's Hospital. So obviously I'm working with some of the best hospitals in the world.
My co-op experience has been unique at Health Systems Engineering Institute because I've had the opportunity to come back home and work where I've grown up, in Seattle, Washington. I've been able to work with local health systems such as Virginia Mason and Harborview Medical Center. At other co-ops I might be working at one specific hospital, but this has really allowed me to kind of work on multiple projects with multiple systems, and having that diverse array of experiences really strengthened my experience as an industrial engineer, especially working in healthcare, I'd say. I would definitely recommend this program to anyone studying industrial engineering, whether you've considered healthcare or not. I know I didn't first consider it when I first selected it as my major, but I definitely see now that as industrial engineers, we can make a lot of big impacts in healthcare throughout our country.
Anyone interested in industrial engineering, as well as even a nursing student, I think anyone who has any interest in healthcare at all could apply.
Co-op's amazing. The before-after contrast for a student who's really not that much older, 6 months older, before their first co-op and after their first co-op is amazing.
That Dr. Bennion had this idea that all across the country there's a set of tools that's readily available, and if we can train up people to provide the level that healthcare institutions need but don't know where else to go, then we can substantially change the cost and the efficiency of healthcare. And I think it's a great and very true vision.